Hey, it's Austin James. Yes, I'm living with diabetes, but it doesn't have to define me. Thanks to the Freestyle Libre 3 Plus sensor, I get real-time glucose readings throughout the day. The Freestyle Libre 3 Plus sensor is small and easy to wear, giving me the freedom to focus on my life as a parent and a musician. Now this is progress. You can get a free sensor at freestylelibre.us.
Offer available for people who qualify. Visit myfreestyle.us to see all terms and conditions. Certain exclusions apply. Data on file. Abbott Diabetes Care. Per prescription only. Safety info found at freestylelibre.us.
Welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm your host and public health scientist, Dr. Jess Steyer, and today I'm going to answer some general questions about vaccine schedules, why it's important not to delay, and why there's no need to space out your vaccines or change up the recommended vaccine schedule. The clock is ticking, so let's get to it. All right, so do vaccines overwhelm my child's immune system? This is a big old nope. So our kids' immune systems are exposed to thousands of germs every day, far more pathogens than they'd ever encounter through vaccines, even if they were hypothetically to get all of their recommended childhood vaccines at one time. The immune system is capable, more than capable actually, of handling the recommended vaccines without being overwhelmed. In fact, vaccines are designed to work with the immune system to build protection safely and effectively. And the schedule has been constructed very, very carefully and mindfully, and there's a reason why your children are recommended to get their vaccines at the specific ages that they are recommended. All right, why shouldn't I space out my child's vaccines? Spacing out vaccines might seem like it reduces risk, but it actually increases it. Delaying vaccines leaves kids vulnerable to diseases that are preventable. And remember what I just said, the vaccine schedule is constructed to protect your kids at very specific ages, especially corresponding to when it is that they might encounter the pathogens and the diseases, or I should say the viruses and pathogens causing the diseases that we are aiming to prevent. The recommended schedule is based on extensive research showing when kids are most at risk and when their bodies respond best to the vaccines. What is the reasoning behind the current schedule? The schedule is designed to protect kids when they're most vulnerable. For example, the MMR vaccine is given around the first birthday because that's when the immunity babies get from their mother starts to wane. It's all about timing and maximizing protection against serious diseases. Is it true that kids are exposed to more pathogens when they go to the park than through vaccines? Yes, this is absolutely true. As I alluded to earlier, kids encounter all sorts of bacteria and viruses in their everyday life. I joke around, I call playgrounds petri dishes, but it really is true. Now, on the other hand, vaccines expose our kids to a tiny, very safe amount of a pathogen or part of a pathogen, so that their immune system can learn to fight it. It's like a practice run for the real thing without the risk of getting seriously sick. So how can I keep track of my child's vaccines and ensure they're up to date? There are lots of tools for this. So many pediatricians offer vaccine tracking apps, or you can keep a physical record. I know that my pediatrician has an online portal, so I could very easily track the vaccines that my kids have received and also take a look at the schedule for their upcoming vaccines. The CDC also has a great online tool that can help you stay on top of what your child needs and when. Regular visits to the pediatrician are key to staying on schedule. In short, do not delay, do not stray from the recommended schedule. There is absolutely no need to space out your children's vaccines unnecessarily. All right, well, I hope you learned something today, and we have lots more to share. You can get your daily bite of health every day, Monday through Friday. If you like what you've heard here, please let us know. Leave us a review and be sure to tell your friends. Remember, there is no single or best way to parent, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
From the terrifying power of tornadoes to sizzling summer temperatures, AccuWeather Daily brings you the top trending weather-related story of the day, 7 days a week. You can learn a lot in just a few minutes with stories about impending hurricanes, winter storms, or even what not to miss in the night sky. So listen and subscribe to AccuWeather Daily wherever you get your podcasts. That's AccuWeather Daily wherever you get your podcasts.